I'm speaking with Dr. Katie Beleznay of University of British Columbia about the use of neuromodulator injection therapy in men.
Yes.
Some tips on how to get successful results.
Yeah, I think your male patient, you really need to treat them different than your female patient. Men in general have a very different anatomy, they have different brow position, they have different needs. And so I think when you're approaching a male patient, there's a few things you need to know. First, you often need a larger dose. Men have stronger muscles in the face, and so you need to be able to approach that. Also, for a male patient, the horizontal forehead lines are actually quite a unique and needed masculine feature, and so you don't want to give them a completely frozen look. That wouldn't be a good aesthetic. Also, with men, you don't want to overly arch the brows. That could feminize their face. And so approaching the treatment, I think you need to understand these things to create a look and create an aesthetic that's appropriate for your male patients. And so it's a really important part of your practice. We think that about 10% of cosmetic patients are men, and so you should know how to treat them as well.
So, by what multiple do you increase the dose compared to a female patient?
That's a tough question. It really depends. Sometimes, on average, say maybe if you use 20 to 30 units in a female glabella, maybe you'd use 40 to 50, maybe even 60 units in a male patient. But some men don't have as strong of a frown muscle as others, and so it does really depend on the man himself.
And I know that one of your key messages is less is more.
Mm-hmm.
And so
Yeah.
With men, I suppose more is just a little more.
Yeah, exactly. You don't want to I think that's a good point in that, like I said, you don't want to freeze a face. That's not the aesthetic most people are going for, especially a male patient who may need their, masculine features to display emotion or whatever it may be, same as a female patient. And so I think you can always treat less and bring them back in a couple of weeks and add more. The caveat to that being that for a male patient, you're probably going to need more if they have a stronger muscle. And so if you underdose them too much, or use like a light dose that you may use in a female patient on a male, then they're just going to overcome that with their muscle strength. And so you need to use at least enough to see the result that you're looking for.
And see them back fairly soon, I
Yeah,
imagine.
yeah. We typically bring, especially a new patient who's never been treated before, we'll bring them back in a couple of weeks.